All right, we're gonna have the people share the highlights from each group. If you could have your seats again. We're just gonna hear briefly from each group. Please have a seat. Not yet. Sorry, I didn't have enough slides in there today, so. So we're gonna have Chris come back.
I don't know if you were supposed to take notes, but we did. Maybe you did, and maybe you guys have more things to share, but a couple things I did want to share from our group that I brought up. One is that we don't charge you for a transport. So if we take you or a family member to the hospital, you will not receive a bill from us. Your insurance company will be billed, but if you have a copay, we will not be billing you. That's just the department that made that decision a number of years ago. You're already paying for us, so we don't figure saving your insurance company does us a lot of good. So we're still going to bill them, but we're not going to bill you as individuals. The other thing I wanted to mention is even though we're called the fire department, just a reminder, we are not a department of the city, and it's very confusing for people. We are an independent agency. We predate the city by decades upon decades. We have always served the island, Bainbridge Island. Our actual name is Kitsap County Fire District number 2, and we were founded a long time ago. So 1942. So the city, when it incorporated, said, hey, we're gonna now also be the city of Bainbridge Island, but they never like took us over in any way. So if you are happy with what we do, that's because of the fire department. If you're not happy with what the city does, you can complain to me, but it's, I'll be right there with you. You know, so there's just a lot of confusion because of our name. So I don't know, was there more that you took note
Well,
on?
it's one thing that I wanted to reiterate. When they walk in the door, the first place they're gonna go is your fridge, make certain you got food. They're looking for that piece of paper. So get it up on your refrigerator. If you got food, that's a nice plus, but they're looking for that piece of paper. It ought to have your birthday and, you know, how old you are, and it's gotta have your medications on there. That's what they look for.
So on the outside or?
Yeah.
Preferably on the outside. Not wrapped around the mag. Put a magnet on it.
And get airlift insurance.
Have some kind of headline that your attention, or you just trained to look for a list of medications.
We're pretty good at finding stuff.
The question was, is there a, what was the question again?
Well, how do you identify this piece
There,
of paper?
there used to be something called the file of life that somebody was, it's like basically a tube, and those were easy to spot. But if you put, unless you have 400 pieces of paper on your refrigerator, it's pretty easy for us to go, that one. And if you do end up with a post, they are a very distinctive color, and we can spot those a mile away, and we're looking for those.
And where do you get that false paper?
So that's something that you can probably deal with more than I can, but I will say it's from your physician. It's a discussion you'd have with your physician, and they're not for everybody. They're more for people that are closer to the end of life.
If you know you don't want CPR, don't want resuscitation.
Is it also known as a DNR, do not resuscitate?
It's the same thing, but maybe it's a more official name. You can say you're a DNR in a lot of different paperwork, but for us to easily recognize it, because we work under physician's orders, if you give me a healthcare directive, I'm gonna say, I can't base our decision based on a healthcare directive, because I'm not a lawyer and I don't have time to look at that. You show me a ugly green piece of paper, I can go, yep, great. It's super easy for us to recognize. POLST is physician's orders on life-sustaining treatment. Sorry, we got a lot of acronyms.
All right, thank you so much.
Sorry.
All right, Julie, would you come back up with your note taker?
I will say that was gonna be my first comment. I thought it was Pulse. I had to ask about it, and it's POLST.
Yeah, both of you in front of the camera.
Oh, yes, 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 yes.
Oh, you can see.
Yeah.
What were some themes? I'm trying to, we talked about a lot. We had a lot of things.
Well, the post.
Mhm.
Then we had a question about someone on Bainbridge. If they're taken to St. Michael's and admitted, and they want to go to Seattle, is that possible? And basically, the answer is no, unless there's a medical need. For example, a heart transplant. They don't do them at St. Michael's. And there must be an accepting provider. In other words, where you want to go in Seattle has to have the bed and the physician's approval. So that was, I thought, of interest. And one other, IVC, because I think many of us here work with IVC, was very interesting. And I ran into something similar personally not too long ago. IVC is often asked for volunteers to take people to colonoscopies, for example. And the problem with that is the person who drives the care receiver has to go in and sign something and stay there and then take them home. And that's tricky because that's sort of IVC and the person being liable. I mean, hopefully most of the time nothing had happened. You just lose several hours sitting there. But if something did go wrong, you know, what happens? And that's, you know, how we figure out how to take care of that, because some people, Joanne was saying, some people on the island simply do not have anyone, a friend, who can drive them and take them. So, and we want to help them.
Yeah, and much of that is about the outpatient procedures. There's sometimes they're elective and they do those phone screens prior to, and they do require people to stay. Most of the time, those are when people are sedated and they have to, or, you know, be put under for a little bit to come out of that. So they have to have transportation back. Somebody had asked about, well, how come the hospital can't send you back? And we have a pretty extensive policy, and it really is about regulations for the really the national regulations. We can't incentivize people to come to us, so we can't say we're going to send somebody to come get you so you can get your test here, and then we're going to take you home. So there has to be choice, and people have to be able to choose where they want to go. If you're admitted to the hospital and you have no way home, we'll work with you to get you home. But we can't pay for you to get there, and we can't pay for you to go home from elective outpatient procedures. And it's not necessarily safe either for people to go home with no one all the time. So.
And one other thing I'd add, someone asked if you're not one of the people to whom a social worker is automatically assigned, is it possible to request one? Yes.
Yeah, absolutely.
Thank you.
Right.
I have a question from the Zoomers.
Yeah.
Yeah, so a lot of us, didn't know about what you mentioned about, so the person who is helping you, you need documentation to apply for those government benefits for them. So the question we had was, is that like a form or is that like a notarized letter?
So yeah, there's a standard form that's online, and it's the Northwest Justice Project, as well as what is it? Washington Legal Health has a good form that the state accepts. So, I mean, there's a lot of really good durable power of attorneys out there that are done by amazing attorneys. This is just something we've learned has been a barrier, is that they don't all say giving people permission to apply for those government benefits. And then there's a caveat in there to allow them to be placed somewhere. So what happens is we have people with memory issues that have decompensated and they're just declining at home. They can't sign another power of attorney. It's just, they're not capable of doing that. And yet they need placement, but the state isn't going to pay for that if you need Medicaid for long-term care, unless there's specific saying that your surrogate is allowing you to elect for those benefits. So it's a little tricky, and it seems like it's just kind of coming up in the last year. And and hopefully somebody reads into that a little differently at some point, but I think if you've gone to that degree of getting DPOAs, like that's what you should have, but the language, yeah.
Great. Well, thank you so
Yes,
much. That's
thank you.
wonderful. All right, and our last group, Joe and Catherine.
Why don't you start?
Trickster here. Let's see. Well, we talked about honoring the process and, we were hearing testimonial on choosing life after a spouse passes and how critical that is, how important it is to recognize that your own life matters and that you still have one to live. I heard also from people saying they wanted to believe more in that afterlife and how that eliminates fear. There are loads of books out there now and movies that are very credible experiences that people have shared. And that's just one place to start. But beginning important conversations is so important, even amongst your friends. We're finding that talking about death over dinner can be just as fun as any other conversation because we can both laugh about it and get to the nuts and bolts of what's coming up for ourselves. That there's importance in acknowledging the fear that we might have around death and to find more ways to discuss it. And one of them, of course, is to come to our death over drafts that we're having on the 21st of this month. You don't need to drink to be there, and there's plenty
But
of
you can.
non-alcoholic things too, but we get into some really wonderful conversations and it's enlightening.
And I would just add that we learned that Catherine's a really good listener too. I think we talked more in our group than she listened, and she's a good listener. We heard a little bit about her as an intuitive healer, and that has to do with listening to those who have gone before us and hearing what they have to say, and that her automatic writing is that too, listening to what those who have gone before us have to say. And that's something that Catherine is skilled in and obviously believes in and has made a difference in a lot of people's lives.
Thank you, Jen.
Well, what a great evening this has been. I want to thank you all so much for being here, and thanks to our wonderful presenters. Next week, we'll have 4 again. Ariana Alexander Davak is an elder care advisor, and she'll talk about housing options, what it takes to age in place, and how to access goods and services. Cheryl Tiefke will be here from Multicare Hospice, and she'll help us understand palliative care and hospice care, the differences. And then Melissa Blanchard will speak on downsizing. Anybody have a attic or a basement full of stuff? Yeah. How not to leave your stuff for someone else to deal with. And then Katie Auger and Jackie Fabry from IBC will be here sharing resources for both patients and caregivers, and tell you about opportunities to volunteer for IBC, as all of us will need help at some point, and it's wonderful to pay it forward. Okay. So I'll leave you with that idea that, we have this fear, but when we gather, when we have the conversations, it really does make a difference. Don't forget to shake and zip and feel for your heart. Thank you so much. We'll see you next week.